I think the most important and most impactful advocacy is anything that makes the issue seem real to that legislator, anything that an advocate can do to really illustrate how this is acting in the district in real life. So, calls and emails are important because they show volume, they show awareness. We just talked about how you might not see home health at home in your district, but it's important to know that it is there and how many people really do rely on it. Meetings are important because they allow providers and advocates to explain policy details and to answer questions in real time. But home visits are also incredibly powerful because they let policymakers see what care looks like at home. And when a lawmaker meets a patient, a family caregiver, nurse, therapist, whoever is working within that home, the issue becomes much harder to justify as just a budget number. So the best advocacy is kind of a mix of all three: clear data, a specific policy ask, and I would say more of a human story to let them know what that looks like at home. I think sharing your story is the easiest and most impactful thing you can do right now. It's the simplest step and it connects to a specific ask. So you want to make sure that you are sharing your story and then saying, and this is why you should support X, Y, and Z. And that's really a first step that you can take. You don't need to be a policy expert to be an effective advocate. It's really just sharing your story. If you're a patient, family member, a clinician, your experience is vital into sharing this entire continuum of care. You can start by contacting your member of Congress through your Share Your Story feature and explain why home care matters to you and what challenges that you see in your day to day life, what you're experiencing as a caregiver or as a family member or a client, and why protecting access to Medicare is so important to alleviate the challenges that you are facing. I think the phrase at the table or on the menu is very true in healthcare policy. If home care advocates are not speaking up and sharing their stories, decisions are still going to be made. We've seen that this year, even while we're at the table. So they may be made without understanding the real world impact. So we have to make sure we get in there and share our experiences so the broader continuum of care is known to these legislators and decision makers.